So welcome everyone to another virtual meetup. And today we have Jennifer Gann with Health Literacy. And before I start making you tell us about yourself, I do want to say when you do have a question, go ahead and use that chat box. I think most people who have been attending these are pretty familiar by now. And Shelby will make sure that we get all the questions from the chat box. So Jennifer, I'm going to open the floor to you, and tell us a little bit about what you do at UAMS, and tell us what your office does. So paint that picture for us.
So I've been at UAMS for about 3 years now. I have a background in sociology, a healthcare MBA, and over 15 years working at academic medical centers. Before UAMS, I was working in clinical research for Alzheimer's, depression, schizophrenia, for a psychiatrist that had that specialized in the Hispanic population. And at the Center for Health Literacy, I manage the research side. So we have two programs. So it's either the programs and services side, which is they do plain language editing, and we do field testing and create new materials. And I manage the research side. So any research projects that we have right now, there's two that I'm working on. Both of them are in diabetes education and both in regional programs, which is really important to me because my in-laws are living in rural Southwest Arkansas. So that was really my introduction to see how important rural healthcare is. And the other project that I'm working on is a few of them for TRI, and they're all focused on vulnerable populations.
So tell me a little bit more. So define vulnerable populations for those of us who don't understand what that means.
I'm mainly looking at certain groups of people that are going to be at higher risk. So thinking about right now we're focusing on, we had high mortality rates for birth rates, so looking at pregnant women as a vulnerable population. And we also consider people with limited or low health literacy as a vulnerable population. So that's really where I come to the table and kind of think about those issues that surround communication and addressing things that might be barriers to care for that group.
Yeah, so let's dive into this thing called health literacy. So if you will, define what you mean by health literacy. Like, what is that?
So health literacy it's the degree to which an individual has the capacity to obtain, process, and understand basic health information and services that are needed to make appropriate decisions about their own health. And we need a lot of complex skills in order to navigate this very difficult healthcare system. And it's not just like documents and forms, but talking quantitative. So anything that has to do with numbers. For example, if you have diabetes, you have to know how to calculate carbs and check your blood sugar and then do which dose of insulin do I use. It's very difficult. And that was one of the things we saw in our study, but also digital. So digital healthcare is putting a lot more demands on people all the time. So you access your medical records online. There's a lot of health apps and wearables out there to help you track and learn about your health information. And currently I'm on the Mobile Health and Wearables Subcommittee for IDHI, and my interest is using those digital health technologies to increase access to care and improve outcomes for rural and underserved populations. And the challenge of this really is doing it in a way that doesn't increase that digital divide, and healthier people healthy people healthier, and leaving the others behind. And so I really want to think about health literacy not just as knowledge, and it's not dumbing down information, because we can all benefit from clear communication.
Yeah, absolutely. Yeah, that is cool. I mean, you're absolutely right. It's not about dumbing it down. It's about creating better, more effective communication. Exactly. So how does health literacy impact health?
So research has shown that low health literacy is associated with lower rates of preventative care, so getting flu shots, vaccines, mammograms, and also with higher ER visits, hospitalization rates, medication errors, and mortality. And all of this leads to higher health care costs. And really, when I first got to the Center for Health Literacy, I really didn't know anything about it. I hadn't even heard the term before. And so when I was learning about it, it was like, oh, this is, you know, patient education. That's really what we're talking about. But now, especially at UMS and just really understanding our system as a whole, I can see how it crosses all areas of healthcare. And even if you look at our Vision 2029 report, and if you were to skim through that, those big goals, I think you'd quickly see that that beyond clinical care, health communication is essential to achieving our institutional goals. And so, like, clear communication really affects everything, and including all areas of the quadruple aim. So we teach this health literacy to all incoming students in interprofessional education, along with patient and family care and research. So it is something that really hits the, you know, those 4 areas, you know, cost savings, population health, looking to patient satisfaction. You have the HCAP scores that are tied to communication. How well did they understand? How well did they explain it to you? And then also the provider satisfaction. And on that side, we're really looking at, you know, burnout, and those kind of things are affected by, you know, the number of patients that they're having to see, the time that they're able to spend with patients. So it's, and when you're, so it's really just, I mean, it's interesting, I think, to see how far it reaches. And especially as we move towards like value-based care, it becomes even more important to focus on populations that struggle with health literacy.
You know, and you talk about populations that struggle with health literacy, but I mean, I kind of want to argue the fact that, you know, regardless of how educated you might be, you know, so I might be really smart in what I do in my profession, but I'm not a doctor. And so,
and yes, I'll be, yeah, that is very, you can't tell. I mean, that's why we say it's, you can't tell by looking at somebody, and it's contextual. So, and I'll be, you know, so that's really, it is important. I mean, we all have issues with health literacy. I mean, because we may seem like we have proficient skills, especially even in one discipline. But if you ask me about, you know, complex fertility care, I mean, I have no clue.
Right, exactly. So how many people in this country struggle with health literacy?
So only about 1 in 10 American adults have proficient health literacy skills, and there's about 4 out of 10 have either basic or below basic skills needed to manage their care and prevent disease. And when it comes to numbers, that's even higher. So you're talking like more than half, it's 6 out of 10 people have a difficult time understanding numbers. And there are certain groups that are at higher risk. And unfortunately, like the other social determinants of health, they're the elderly, people with chronic disease, low income, minorities, and those whose first language is not English. And we've seen that people over the age of 65 really have the lowest level of health literacy overall, and Hispanic adults have the lowest health literacy among the minority populations.
So would you say for those 2 separate groups, are there different reasons for why they struggle with health literacy, or is it?
I mean, there's a lot of different factors. A lot of those are going to be cultural. There's a lot of that is going to be because we need to, it's almost like personalized medicine, you know, everybody's going to be a little bit different. And we really are trying, even with medical students, trying to teach them, like, it's not just about what you're hearing here. It's what is it in their community, things outside, what's in their home, what's in their neighborhood. So kind of thinking about it in that way, it's more broad. Mm-hmm.
And so, so you talked a little bit about language and cultural factors. What are the signs that maybe a patient is struggling with, like, their lack of health literacy? Like, what would be those signs? Like, what should a provider look for?
Some people may give you some hints that they don't understand, such as, I forgot my glasses. You can't just tell, like we were saying, you can't tell just by looking at someone. Patients often will hide their limited understanding out of shame or embarrassment. So we have this training video where it shows this woman who, she appears to be well-dressed, she's well-spoken, seems to be well-educated. She went to the gynecologist for some discomfort, and the doctor says, no problem, we can take care of that. They have her sign a bunch of paperwork, and it wasn't until her follow-up visit a few weeks later that they said, well, how have you been feeling since your hysterectomy? And she was floored. She said she could not imagine that she just agreed to do something, to have a piece of her body taken without her knowledge. So just by, if she didn't, she said when afterwards she was talking about when they handed her all these forms and they're asking her to look at them really quickly, she didn't want to be showing that she didn't know anything and wasn't asking a lot of questions. So
I absolutely identify with that. And I'm going to tell a really embarrassing story on myself. So years ago, I went to the dentist, and they had a special for like teeth whitening, so I'm like, oh yeah, I want that. It was like a Groupon. And so I go in, and of course they do like a teeth cleaning, and they found a cavity in like my rear back molar. And they're like, you need to come in and get that cavity fixed. And I said, oh yes, okay. So they show up, and they start working away. And halfway through that procedure, that's when I realized that they were going to give me a crown and not a filling. Never told me. I didn't ask because I just, and yeah, I have
we didn't know to ask. We trust our providers. We trust our providers. We trust our providers. We don't ask questions, and it's really difficult because there's also a kind of a power differential. You don't want to always like go against what somebody who has authority over you. And in a way, right? You kind of have some of those relationships that are built into those decisions that you make.
Yeah, and like you think they're the expert and that they're going to make a decision for treatment that's in your best interest. And it was not.
And so we really do talk about, so because of what these issues we're talking about, we kind of think of it like hand washing has become this universal precaution, especially these days, right? Since everyone might be carrying the coronavirus. It should also be assumed that every patient may have limited health literacy. And again, like we were saying, it's just impossible to tell. And I kind of wanted to go back to like culture and thinking about, so there was this story that I heard, so culture does impact the health literacy. And I heard on the news the other day, there was this report and they were talking about in Louisiana, so they're saying how like culture has an impact on how this national crisis is magnifying these health disparities in our society. And in Louisiana, there's only 33% of the population are African American, but they account for 70% of the deaths. And, just watching this discussion and hearing them talk about, they were mentioning, health literacy in the discussion. So he was talking about how healthcare communication, that we need to stop using words like comorbidities and hypertension. And really, when we're talking to people in the community, it should be, he was like screaming, saying, do you take pills or should you be taking pills? If you do, you're at risk. Stay at home. Like those are the kind of messages that he was really trying to bring home, and also saying like in the words we use. So in some African communities, they use refer to diabetes as sugars or blood pressure as pressures. So just understanding some of these cultural differences in how they use language is important. And he's also talking about like how you obtain information. Health literacy is also about obtaining information. So in the news, they discuss a lot about misinformation, especially social media. And there were a lot of rumors about it's a white person's disease because all they were seeing in the media was, you know, white people in nursing homes. And there were rumors about the African Americans being immune to the disease. And since my mom's from Mexico, it was really interesting to hear that this was also happening in the Hispanic community. They didn't think the warnings were applied to them. So one of the COVID task forces was to work on reducing barriers for undocumented and Spanish-speaking community, where they were looking at, when they were talking to people in the community, they said they thought it was fake. And there's also a lot of like mistrust and fear. So we're working with TRI to build that trust between the community and our institution, and helping to meet the needs of the community to build that trust. And also for, you know, research purposes, you also want to give them the opportunity to participate. So building this trust is a first step in that. And it was when I thought about this too, I was thinking about culture. Thinking about the story that Amber Booth told the other day when she was talking about diversity, and she highlighted the importance of cultural considerations and the impact of miscommunication. Her story was about someone who is a native Spanish speaker, came in was having an issue, and because there was a word that was similar in English and in Spanish, there was a miscommunication, and that led to the person undergoing an unnecessary surgery. So I mean, these are things that really can impact people's lives. And I guess it's kind of, I just wanted to take a little like a side break. So when you hear talking about sugars, it reminded me about, it's not only about the patient's culture, but it's about our culture at UAMS. So we're in the healthcare field, we use a lot of jargon, and we really want to try to use more living room language. So instead of comorbidities, you'd say like person with more than one disease, you know, or when you're saying like hypertension, blood sugar, glucose. So I just wanted to throw it out there. Can anybody out there think of a couple jargon words that you use on a daily basis, and maybe a plain language, easier thing to use for that?
We have had some, we have had some chat comments come in. So
Okay.
We have Tim, he commented, we make a lot of assumptions about what our population understands. And Marcus kind of followed that up with, most people don't even know what a provider is. So we try our best to say doctor. Same with practitioner. We are still dealing with the best way to describe them. And and he recommends that the more that we can educate in the schools as children are growing is the only way that he can think and actually change this mindset.
So Tara Swindle has a program that's called WISE, and where she's going to elementary schools and teaching kids in Head Start about where food comes from, meet your farmer, like getting them familiar with food and health and healthy foods, and understand just at a young age. I think that's really an important part of it, as well as just how much we teach more than just the grammar and things like that, but just really how to take care of themselves. Really good point.
Yeah, it really,
like thinking also was thinking other than language and culture, context. So this one is really important. So context can affect your ability to learn. So health literacy is also a state condition. So your current physical and mental health, like Dr. Macias mentioned in his talk the other day, that stress can make it difficult to understand and comprehend information. So like I said before, I mean, you know, I may seem to have adequate health literacy skills, but I guarantee you put me in the emergency room with my family and all that goes out the door. I'm not even there.
I know, and you're right about so much cultural stuff. I mean, I think about myself in the doctor's office, and before I go, I have to really center myself and think about what are the things I want to ask about, because once I get in there, it's like that pressure to be, everything's great, everything's groovy, oh, I'm fine, good to see you. Like, what am I doing? I'm at the doctor, and I'm like wanting to just be like, hey, everything's great.
I do the same thing. I do the same thing. And then afterwards I'm thinking, well, I was there. I should have just asked him about it.
See, I struggle with even, you know, so I started at UAMS, I guess, about 3 years ago. And like, I get confused, and I will be completely honest, I still don't know, like, the difference between like an attending physician, a resident physician, a fellow. Like, I'm just like, they all have physician at the end, so I guess I mean,
Yeah.
I don't know, but they're all different things, and it's nice to know, because when you can understand that context, you can understand more about your situation. But like, I don't know what the difference is. I don't know.
I still haven't figured that out either.
Yeah, I'm like,
But you know, I really like what you said about your story about, you know, putting it in plain language to people. Like, are you taking pills? Do you have to take pills every day? You know, then that you are at risk, you know, because when you hear comorbidities, that sounds like something that other people have, or, you know, I think of someone walking around with an oxygen tank or something, you know, it's just.
Is it like, I think you would, from communications, isn't it like using active voice versus passive voice, because you're directing it to the person, and they can, otherwise they'll be like, oh, that's not me. It's the other 10% of people. It's not, you're not talking to me. So.
Exactly. We are never, you know, yeah. When I hear someone talk about, you know, someone on the news, a 40-something-year-old woman did something like super embarrassing, I'm like, oh, that's embarrassing, and 40 years old, and I have to go, oh wait, I'm 40-some. Oh yeah, I'm in that same. Oh yeah, that's my age group. Yeah. So how do we increase? So if we want to increase our health literacy, besides just, you know, the services and things like that, but like if I personally want to increase my health literacy, what can I do?
So we really think about health literacy as like a seesaw. So on one side, you're going to have, you can increase demand, the skills of the individual, but we can also lessen the demands as an institution. So when you're thinking about the individual, you want to improve skills to learn how to better communicate with our providers, and how to search for good information online. And as you were saying, ask questions, you know, don't be afraid to ask questions. We do have resources on these topics, and so just contact us and we'd be happy to share some of those. And on the other side of it, the demands is really things that we can do to lessen, is like going back to culture. It's using plain language and numeracy best practices, confirming understanding through teachback, and advocating for organizational health literacy. And so, which includes things like designing materials that are easy to use, and workforce training, to not only so that our workforce is health literate and able to take care of themselves, right? We want our employees to be healthy and be able to take care of themselves, as well as our patients.
Yes, most definitely. And I saw a little, you know, I went to your website for your office, and I saw a little bit about what you do. So talk a little bit more about the services that you offer. Or
like I said, on the plain language, the services side, we do editing with both English and Spanish. So we have somebody who is a plain language trained native Spanish speaker. We do new materials creation for high stakes like materials really that impact a lot of people. We do field testing, so we get a group of people together to, and we always learn something new because it looks great to us, but you put it in somebody where we have community members who come in, and some of those struggle with health information, so always have good feedback. And if you would like, your department would be interested in some plain language training, especially to help move that Vision 2029 forward, just let us know. We'd be happy to either give training or materials, and in a lot of cases we can do it at no cost. And we also have time covered under TRI to provide researchers with help with their informed consents, anything that has to do with patient-facing, so recruitment documents, and those we do at no cost. And we have some samples of the documents, materials that we've created on our website.
Excellent, excellent. Shelby.
So we do have a question. So how has law language affected health literacy where they are trying to protect the organization?
So this comes up a lot, and I didn't get to this, but I really had hoped to kind of talk about healthcare costs. So there are higher costs, and so there's a lot of metrics. So we have reimbursements that are tied to plain language. So it was 2010, there was a Plain Language Writing Act saying that all of the communication coming from governments has to be in a way that's easy to understand. So along with these, we have worked with, so we have somebody on who's affiliate faculty now, is Chris Trudeau, and he's a lawyer that specializes in plain language. So we were working a lot on, so even just taking things like consent forms. So we have, one of the projects that I'm working on is with TRI is taking we created a plain language consent form that we want to turn into online interface so that it spits out a clear plain language consent form for the patient to sign. And so things like that, but that we're working with Chris. So legal does get involved. And a lot of times when it comes to other things, like we did the advanced directives. So we had a project where we brought a group of people together, and even we do our edits and work with them to see which parts need to be in there. And we're trying our best to make those words easy to understand, because I mean, we've read them, and it's very difficult. And I think we have a long way to go when it comes to something like that.
Wow. So as we wrap up, I have my catch-all question. So what am I not asking about that I should be asking about? Is there something that we didn't touch on that you're just dying to touch on?
I think just really, health literacy is an ongoing conversation. We're always looking and seeking new ways to improve communication of complex medical information. So I want you, and I'm always looking for examples, kind of want you to think about what are the patients or community members that you serve where you think UAMS needs to communicate more clearly, or are there things in your department that people struggle with when it comes to communicating with patients, something you're trying to explain over and over again, when, if you could come up with, a handout or something that could help you with that, that would be some things that I would like you to think about and kind of consider. As we say, it's an ongoing thing. We're going to have new technologies and new information, and it's only going to get more complex.
Yay!
But I think in the end, I think we're always looking for ways to serve UAMS, and I think you, with your communication background, and we probably all could agree that communication benefits everyone.
Yes, it does. Yes, it
Clear
does.
communication.
Well, thank you so much. We are at time, and I just want to thank you. This was so interesting, and I mean, what a great resource you are for our campus and the community, for everyone. This is just such important work. And so I just really want to thank you for taking the time to take 30 minutes with us and let us pick your brain. It was a lot of fun. And for those of you that are on the call right now, don't forget, we're doing Tiger King trivia today at 4 o'clock.
What?
Yes.
You're welcome to join us, Jen.
You're welcome to join us. I'll send it to you. It's
Yes.
just a lot of fun. So, all right.
Well, thank you for having me. I really appreciate it.
Thank you.